What I can tell you is we've now started working with the ESD and our school districts, all of whom are working very diligently on safe reopening plans. I can tell you that nobody is as concerned as these professionals are about the health and safety of their kids and their staff. I've been very impressed by the amount of work and concern that's going on as they're preparing. My thoughts on this are that we need to prioritize classroom education as an essential service. I believe that everybody in the educational profession and the pediatricians believe that there really is not a good substitute for classroom teaching, especially in the earlier ages. We need to make educators essential workers, and we need to assure that as essential workers, schools get onto the emergency management PPE distribution list, just like nursing homes, hospitals, and ambulance services. We are not there yet. We are beginning to ring that bell, but I believe that's critical because we're not going to be able to safely reopen schools without sufficient PPE. The second thing I want to leave you with, or thought I want to leave you with, is that schools can be an accelerator of COVID-19. So remember, kids tend to tolerate this well. It appears that they do contract and spread COVID just like adults, although there is some early indication that perhaps younger children are less likely to transmit the disease. But the point is, when the incidence in our community is low, so if we're down below 25 cases per 100,000 per 14 days, the impact that schools would have is low. It is unlikely that kids would contract it and unlikely that they would be in school with it just because the total volume of disease in our community is low. The problem is when the disease burden is high, then schools become an accelerator. So schools are a place where kids intermingle, pass the virus back and forth, and then take it home, and take it home potentially to medically frail or vulnerable people, and or take it home to their parents or siblings who may be working in healthcare or as caregivers for the medically frail. So I want you to think about schools like wind on a wildfire. So schools are the wind, COVID is the fire. If the fire is not burning very high, we can tolerate a lot of wind. But if it's burning pretty briskly, that wind is going to spread it all over the place. And that's our concern about schools. So we have to look upon schools and the essential work of getting kids back into classrooms. That's only going to happen if we can get the incidence down. So getting the incidence down is going to allow businesses to reopen, and it's going to allow schools to have kids in classrooms, which is essential.